So today I will be showing the assessment on the quality of Caring Arms healthcare services for the older generations from the patient's perspective. So the introduction to the needs assessment. The one group of target stakeholders are the patients. These stakeholders will be providing their own personal experiences when they are receiving the care for the needs assessment that will help the organization. With all of the information gathered from the patients, the feedback will be able to be utilized for a better outcome. Needs assessment. To get the information from the stakeholders, different people will be interviewed in order to get their personal views on the care they have received. With this information, we will be able to see how the services are being conducted, what the patients think about the service that is being done, and if there are any things that need to be done and changed to better the quality and services to the patients. Type of data. The data that will be collected is primary data from the patients. It will be qualitative data as personal experiences from the patients with the organization. This method was chosen because it will allow for the feedback to be straight from the stakeholders. The type of data that will be collected will be from the first person at hand. The data that will be collected will be from the interviews that will be done. Data collection. The data will be collected at the participants' homes/places of the patients. It will be easier access in order to speak to as many people as possible and get enough feedback from them. The data collections instrument will be administered over the phone for those who are not able to have an in person interview so that they can be better assisted. With the data that is collected from the stakeholders, each patient's feedback will be different from one another as they will all have different perspectives on the type of care they are receiving. Not all patients will talk about the same issues or services, and this will be able to help the Caring Arms Healthcare organization. Stakeholder recruitment. The target stakeholder will be recruited by speaking with the organization and finding patients that will be willing to participate. Many of these patients will have different needs that need to be addressed and will have to be accommodated. The stakeholders will only be those who want to participate in order to have a good selection and different types of feedback. These stakeholders might be hesitant to respond as they might not feel comfortable at first. For those answering the interview through the phone, it will be a lot easier for them, but it could also mean that they might have some issues with the phone call itself. They will be in an environment that allows them to answer freely as they will be in their own homes/places. Dissemination plan. The needs assessment results will be disseminated to the organization and the target stakeholders presented as a paper. The results will be presented via email and will be submitted to the organization for them to review. With the paper report, they will be able to see what goes on firsthand with their patients and will be able to use this information to improve their quality of services. And these are my references.